Hello, good morning, good afternoon, good evening. I'm Lindsay Denny, one of the instructors for the Washington Healthcare Facilities Distance Learning course with UNICEF. And I am joined today for a special roundtable discussion on engineering with engineers working in the fields. We're going to have an opportunity to talk about some of the challenges, opportunities, barriers to providing WASH services in healthcare facilities. Specific for those of you who are looking at more of the service provision perspective. So I'm going to give a chance to let each of our special guests introduce themselves. So I'll start over with Mike.
Hello, everybody. My name is Mike Paddock. I am the chief engineer at Engineers Without Borders, but currently on sabbatical to UNDP, assisting with the COVID-19 response. I'm a licensed civil engineer and land surveyor, 30 years working in the consulting business, primarily around water and wastewater treatment. So WASH in healthcare facilities is something I'm very passionate about, spent a lot of time out in the field, seeing the impacts that can happen when we do improve WASH in healthcare facilities, and have frankly taken it on as a personal call of action to do what I can to address WASH in healthcare facilities.
Thanks so much, Mike, and so happy to have you here. Hiba?
Hi, my name is Hiba Abudrob. I work with UNICEF in Ethiopia country office. I have less number of years of experience, but that comes up to around 15 years. I've been working specifically on water and sanitation systems, but also on solid waste management. And that would be it. Thanks.
Great, thank you. And Jose?
Hi, everybody. So my name is Jose Gesti. I'm also a civil engineer by training, specializing in water resources, microscale hydrology, and climate change. My career has been going a little bit from the private sector, working with water and sanitation, quickly into technical assistance, and then I became a civil servant for the Ministry of Environment and Water Resources in Spain. And then after that, I became a UN official working with UNICEF as a water specialist, also working with climate change. And then after that, I was working in Jordan as a chief of WASH, and now I'm working as an international consultant, working with water, sanitation, and climate change, basically. So I'm very happy to be part of this discussion with my colleagues, Hiba and Mike, and thanks, Lindsay, for organizing this.
Yes, thank you all for being here. As school public health helping put this on, we certainly don't have the engineering expertise, so we're really excited to talk to you all. And I wanted to start today thinking about some of the common pitfalls, some of the common issues that you may have seen when doing WASH in healthcare facilities. And I'm sure the participants could put their own comments in the chat box here about things they've seen as well. Maybe starting with you, Mike, and then just going around the room, the Zoom room. What are some things that you have seen go wrong when people try and do WASH in healthcare facilities?
Yeah, a couple of things jump to mind, Lindsay. One is people sometimes jump to solutions without an appropriate assessment. And, one of the things that I love about one of the quotes I've heard is that if you have 1 hour to solve a problem, spend 50 minutes identifying the problem and 10 minutes on the solution. And I think many people jump to the solution without really fully understanding what the problem is in the context. So that would be one common problem that I've seen. And the second is, especially for healthcare facilities, seems like wastewater treatment seems to be something that drops off the radar screen a little bit. And us as engineers need to make sure that we have a responsibility to make sure that whatever clean water comes into the system is treated before it's discharged back out into the environment.
And Mike, I know you have a personal story from that, of seeing that happen firsthand in facilities. So I appreciate you bringing that in here. Hiba, do you have a pitfall that you've seen happen in Ethiopia or elsewhere?
Sure. One of the things that is really mismanaged is the hazardous waste that comes out of the healthcare facilities. That's usually not properly handled and is just handled as if a regular waste, while it's absolutely not the case. To double Mike's discussion on spending more time on the analysis and understanding the situation, we usually or often find the facilities much undersized in terms of the water availability of water, but also for the sanitation management on site. Thank you.
Yeah, and that's interesting you point that out, because I feel like engineers in other contexts doing WASH don't think about waste management. And so when you come to a healthcare facility, this is a new facet that you're undertaking. And how do you manage it correctly? What are the solutions that are available? Are incinerators good? Are they not? You know, there's a lot of questions there and a lot of resources that need to be reviewed prior to initiating any solutions. Jose, do you have any thoughts on pitfalls you've seen?
Well, maybe a little bit more overarching, but my comment always been working with WASH in healthcare facilities together with WASH in institutions in general, the same for schools, is, you know, this tendency also from an engineering point of view of copy-pasting things, you know, a project that it's being implemented somewhere, you think that it can be completely copy-pasted and replicated elsewhere. And that's such a huge mistake. It can lead to really bad performance of water and sanitation systems. So the idea of contextualized situations, also from, I will come later, but as a, you know, from a climate change point of view, or purely a climate perspective, understanding the context where you are is essential. You cannot just pretend that you will just replicate something that works somewhere else.
Well, that's a great point. One of the homework assignments, we were asked to say what are some of the climate issues in the country, and people were saying, well, we have droughts and floods. Like, well, we got to get more specific here. We got to narrow down which part of the country, some of these challenges you've seen, so that you aren't having that problem of copying and pasting solutions where the climate risks may vary based on geographies within the country, not even just countries themselves. So that's a great point. So you've touched on a few things that are specific to institutions, or specifically, Hiba, about healthcare facilities. I wonder, when you all think about WASH in healthcare facilities, is it in your mind different from an engineering perspective, or is it the same? What is your approach? And I open this to any of you to respond to.
Yeah, I'll take a swing at that first, Lindsay. For me, it's very different. Certainly, the management of the risk is something that I think us as engineers need to be very cognizant of. So much of the developed world, when we look at, for example, wastewater, we're managing the risk of BOD and COD in the environment. But here, where we're in healthcare facilities, we have high concentrations of pathogens. And that really becomes, for me, the primary objective of our project at a healthcare facility. Because we're going to have a lot of people coming into this facility that are sick. That's why they're coming. They're there for treatment. And they're going to bring with them pathogens. And we need to make sure that whatever we do prevents those pathogens from being discharged into the environment and simply just being recycled back into the population. So managing that risk is really important. Another aspect of the risk is the risk of running out of water, right? It's one thing to run out of water in my house, or maybe running out of water at a school, but running out of water in a healthcare facility is really something that we need to manage at a higher level of risk management. So what does that mean? That means making sure we've got a more reliable source. That means that we've got more storage, that we've got backup solutions in our facilities themselves for making sure that when a sink goes down, or a hand washing station goes down, or a shower goes down, that we've got supply chains established to be able to get them quickly repaired, because the risk profile is so much higher for healthcare facilities than it is for other institutions or household waste.
So Mike, it sounds like on that point, it's like you're not only how you build the system initially, which needs to be a smart system, but also the operation maintenance you built into it to make sure that the system is always running. And if it's not always running, there's a quick solution to that's built into the system. Is that what I'm understanding?
Well, of course, when it comes to facilities, industrial facilities, schools, or healthcare facilities, maintenance really falls on the owner of that particular facility. So in this case, the healthcare facility itself. So who's going to be doing the maintenance? What's the qualifications of those folks that are doing it? Are there proper procedures and supply chains for parts? Those kinds of things really become important, because one of the common pitfalls that we do see is deferred maintenance. And this is really not surprising, right? Because the healthcare facilities are managed by administrators that typically come from healthcare background.
Right.
And is it surprising that if you're an administrator and budgets are always tight and you have the choice of, do I reduce staff? Do I reduce pharmaceuticals? Or do I defer the maintenance on that water pump? The natural tendency of that administrator is to say, well, I think I can get one more year out of that water pump, and I'm going to defer that maintenance. And then all of a sudden we end up with a problem, because finally the chickens come home to roost, as I like to say, and the system fails. It's what I call the wash death spiral. You know, we defer maintenance a little bit every year, and then pretty soon the whole system collapses, and we go, wow, how did that happen? Well, it really probably isn't surprising.
Yeah, Jose.
Well, related to the question as well, you know, that you're making, and perhaps looking at what we're discussing from a different angle as well. One of the things, you know, when jumping into this sort of discussions as well, one of the things that I see is that we tend to talk about engineers, water and sanitation as engineers. I think we hear, when it's in relations to institutions, specifically healthcare facilities, or it could be also in schools, I think we need to be also very mindful and careful about the different competences between architects and engineers. I'm saying this because here, you know, right where I am from and where I'm based, you know, the water and sanitation provision in a healthcare facility is a competence purely of an architect. And I think sometimes we need to be very careful with this, as I say, because we tend to invite, you know, the engineering thinking into it, but and this sometimes, it is my opinion, and I don't have a proof of it, you know, but because we do this, we tend to, you know, give for granted that the architect will build the infrastructure, and then later on, at a certain point, somebody will look at it, an engineer will come and will do the water and sanitation, and that's a horrendous mistake that we can go, you know. So be mindful of the different competences in the places where we're working, and just to make sure that we don't step on our shoes. And a project, whatever it is, whether it's retrofitting an existing facility, or more importantly, if it's going to be a new facility, we need to make sure that if an architect is on charge and, you know, leading the planning of the infrastructure, that the water and sanitation is already built in, well done, with all the points that Mike has already discussed, and Hiba as well, in terms of wastewater treatment, because it will be at that time, of that planning phase, and we need to ensure that things are right. We don't want to come back later and having to retrofit something that it's a year or 2 years old, right? We want this to be done at first. So, you know, a little bit of being cautious here. Architects working together with engineers. We are not going to say one versus the other one, but just to understand that this is a delicate issue in some context.
Well, and that makes me think, Jose, I've been to a number of healthcare facilities where they've expanded. They have a growing population, they have a larger patient uptake, and suddenly they need another building, for example, for maternity care. And they may be using an existing building that was an office and turning it into somewhere for patient care. And thus the setup is not conducive to, for example, hand washing behaviors. The sink is down the hall, around the corner, around another corner, and is not you know, within short distance for a healthcare provider to wash their hands between each patient. And so I think you see a lot of these healthcare facilities doing what they can. They need an extra building, there's a building, let's use it. But that's really challenging for the engineer to come in after the fact and try and make the situation work. And you may be not brought in for several years. So I see healthcare facilities, I think also the sizes. I think, Mike, you were talking earlier about the size of a healthcare facility. That really varies. Hiba, I don't know if you've worked in Ethiopia. Do you work at different healthcare facilities, health centers, and hospitals?
Sure. So I've experienced that not only in Ethiopia, but also in Jordan.
Sure.
So that's definitely an issue. We need to be mindful on the ultimate purpose of the healthcare facility before we start designing it, because usually what happens in practice is well, we say that, okay, we're going to need a healthcare facility for a certain purpose, and then it keeps on growing. The community is probably growing, and then we ask the civil engineers or the wash engineers to come in and fix the mess, which might be sometimes a bit more expensive than having it thought through from the very beginning. This is definitely something like we see in every field visit and in every community meeting. I know that engineers are not really keen on meeting people or having the conversation with the healthcare practitioners, but it's definitely a very important step at the very beginning of having a healthcare facility designed or put on. So we really need to understand the needs of the community and the needs of the healthcare facility, but also on the thing is we cannot see the healthcare facilities in isolation from the community. Generally, if the community is served with water, that water resource would be also available for the healthcare facility within the community. And that also applies for the sanitation management. So we need to be practical in terms of what's needed. Is it an outpatient healthcare facility, or is it more of a maternal healthcare facility and childbirth or dialysis unit that needs quite a pressure of water available continuously in the system? So yeah, these are a couple of things that we need to keep in mind while looking at Washington healthcare facilities.
Yeah, and kind of building on that, what I would say is that it's our responsibility as engineers to really be the advocates for good WASH in these healthcare facilities, because there's so many different stakeholders. And each of those stakeholders have different objectives, as they should, right? So if we stand on the sidelines as engineers, we'll see maybe the prioritization of WASH and healthcare facilities diminished. For example, when we're building a new facility or doing a large retrofit and we're doing the specifications for the work, many times we may start out with industrial grade fixtures. And I'll tell you from a personal standpoint, that came home to me when I was in Ghana and I saw a lovely lady taking a shower in my sink. I had no intention that sink was going to support an entire person. And now I realized what it means to make things bushproof and make sure that they're really resilient. But budgets are always tight, right? And people are always looking to expand the scope of a program. And because of that, many times at the point of construction, the idea is, well, let's save a few dollars by going with non-industrial grade fixtures, kind of cheaper toilets, cheaper sinks, cheaper piping, all of those kinds of things. And as we know, those just come back to haunt us in the future, right? Something that's going to fall apart in 6 months or a year. And of course, there's never enough budget for doing maintenance. So it's important for us to advocate for good, strong WASH solutions at the very beginning, as there's all this multi-stakeholder discussion going on.
Jose?
Yeah, and if I can also continue this trend of thinking, and also complement what Hiba and Mike just said, I think another interesting thing in terms of advocacy, Mike was just talking about advocacy. I think, one of the tensions that I feel we have as engineers, working in this environment, which is obviously much more a public health environment and colleagues specialized in health, is this tension of working within the facility, and in our case, as we have already talked, the water that comes into the facility comes from somewhere else, and the waste we generate will go also somewhere else. So this tension between working the mindset of a public health worker and somebody that is very fixed to the particular, infrastructure healthcare facility versus our engineering thinking with all this planning that goes well beyond the limits of the facility, it's sometimes a little bit difficult, So I really like when, that's why I wanted to build on this when Mike talks about advocacy, because it's our own, we need to make, as engineers, we need to make ourselves, clear of what is going on, because it's not easy to express, the thinking. Sometimes, we've been discussing before about the wash, feed, and other tools, for that also help to retrofit, and also help perhaps with the design, and it is difficult, sometimes when we were part of these teams, because we have a complete different approach. As engineers, our brain is structured different, we're very much into the planning and very logical into this needs to be here for this to happen, and then the service will be functional and, and all that. So advocacy, advocacy and patience, I could say, from our side as engineers, because we are working in a very multidisciplinary environment with different skills. Everybody's adding on. But, just to make versus, outside of the facility.
I also think that, on top of that, it's like almost like speaking two different languages, clinicians and engineers, and making sure that you both understand each other. And we talk in this class about the Venn diagram of infection prevention and control and WASH. And there's a big overlap, and certainly in COVID, we see that overlap perhaps growing or becoming more prominent. But we don't necessarily, engineers and clinicians don't normally interact in the day-to-day work, and making yourself understood and be able to speak the language, particularly if you're coming into a healthcare facility, it behooves you to speak the clinician's language to help advocate for yourself, right? Rather than expecting them to come to you. I think that is going to be the most effective way to start the conversation, and certainly teaching them more about why your work is important for what they're trying to achieve. I don't think any clinician out there is saying, no, we don't need water. But how you get that water, how you maintain that water, that's a longer conversation to be had within the healthcare facility. And I wonder if we can take a moment to talk about, when we think about those doctors and the healthcare system that you come into interaction with, there's a level of governance within these healthcare facilities. They're certainly not lone entities. And presumably there is some sort of oversight of the healthcare facility upgrades and whatnot. And I wonder if any of you can speak to what it is to work with, for example, the Ministry of Health, or it may be in your country, the subnational government, whoever is the oversight body, who is looking at what you're doing. Is there someone you're working with looks at the infrastructure improvements and whatnot? And how has that worked? Because it's different than necessarily working with the Ministry of Water or Ministry of Sanitation, right? For a healthcare setting. And maybe Mike, you're nodding your head, so I'm going to kick it to you first.
Well, I'm interested in my colleagues' perspective as well, but my experience working with, for example, the Ministry of Health is they are very laser focused on their staff and the health of their patients, right? And so I think it's just really important for us to, again, advocate for this connection between reliable WASH services and how that's going to impact and help them do their job. So many times I'm just reinforcing to hospital administrators and the Ministry of Health is, help me help you. And I want to help you long-term to make sure that we have a sustainable solution so we don't find ourselves in the same position that we are today. And I think that, particularly when you're working with more complex or larger healthcare facilities, and surgeons, for example, can be very aggressive and very opinionated. So you need to be not shy in expressing why your work is really important and why you really want to help. They need to help you help them. And I think that really helps bring that team together.
Great. Anyone else have thoughts on working with local government?
I can maybe come in here. So yeah, in the countries I've worked in, unfortunately, the responsibility of institutions, like for example, the schools is under the responsibility of Ministry of Education, and similarly for healthcare facilities, it's under the responsibility of Ministry of Health. And they do have small specialized departments within those ministries to look at water and sanitation related issues within their institutions. and I'm saying unfortunately because usually they receive a little attention in comparison to the bigger role of the ministry, and here comes the problem. These services are not usually the core of the overall mandate of those ministries, and therefore they're overlooked at many times. I would say that speaking of systems that it would be best if there's a clear accreditation system on the different healthcare facilities, on what's the level of monitoring, what's the level of regular maintenance, just to be part of a bigger accreditation system. But it's not usually the case, and that's the ideal situation. Whereas we need to keep on advocating, as Jose said, that those facilities need to receive bigger attention, and maybe there needs to be some areas of overlap with the Ministry of Water being the major or the responsible Ministry of Water and Sanitation in general. That's my take on this.
Yep, Jose?
Yeah, I think this is a very interesting discussion because I think it's also taking us as engineers a little bit out of our comfort zone, right? Because we are not talking right now in this part of the conversation about the nitty-gritty of the design and all that, but we're talking about governance, and we're talking about regulations, and we're talking about the standards. And I think this is our hook as engineers, you know, even, you know, when we are relating to these little departments that Hiba has been describing, whether in ministries of health or ministries of education, as they relate to different institutions, you know, I think in UNICEF, in many cases, has been providing support to these little departments, you know, to come up with the standards, because that's going to be, you know, that's where everything is going to be already agreed. So we don't have to go into this situation that Mike was describing, you know, when it's too late and having to discuss certain issues. So we better put some, you know, we foster some order, let's say. So, you know, as soon as we detect, you know, that we have these little departments that, as Hiba says, they don't have enough attention, but we can work with them and then pass on some, you know, develop some standards for washing healthcare facilities in the countries. So actually that's going to be, you know, that's what the way I want to end later, you know, my plea is for, you know, having, you know, more examples of washing in healthcare facilities standards. And in my case, you know, I've been doing the review trying to find climate resilience included in those, you know, and the engineering points as well, you know, that as an engineer you need to consider. But it's much better if they are already at this time regulated there and expressed in standards that everybody can, you know, try to comply with.
Right. Well, and that's, I mean, so the 8 practical steps for Washington healthcare facilities have I believe it's step number 2, it's two or 3, is standards and accountability mechanisms. And you touch on both of those there, which is interesting. Developing the standards in the first place, whether they be standalone Washington healthcare facilities guidance, or they are embedded in like an infection prevention and control guidance, but are more robust than traditionally thought of as IPC. It includes the toilets, it includes the wastewater, thinking it more holistically. And those are multiple options. But then what we see is the harder piece is what Hiba was talking about here, is these accountability mechanisms. And is there some sort of process to monitor and license these facilities so that the improvements you are making now are maintained by a health system that is not traditionally WASH focused? And we've seen in other places where, working in Cambodia, where the Ministry of Rural Development also did health centers. So you had 2 ministries both engaged on this issue, but not necessarily coordinating. And certainly as an engineer, though you aren't, like you said, Jose, it's not maybe your bread and butter, it's not your day-to-day is doing this, but how do you help make sure that whatever you've put in place is sustained after the fact? So I want to turn to, we talked a bit about community engagement, but I want to turn back to that for a second and think about human-centered design in a healthcare facility. This term I feel like is used a lot in our modern day. I feel like I hear it, I'm based in Silicon Valley, I feel like we talk about it a lot in technology, but certainly what is thinking about human-centered design, and we talked last week about women-centered design. And what does that mean for you all as engineers thinking about WASH in healthcare facilities in low and middle income countries? Is that something that you consider? And if so, what are some examples perhaps of what that might look like? And anyone welcome to answer.
Yeah, maybe I can comment. I can tell this story of it didn't happen in a healthcare facility, but it happened in a school. So we were improving the wash facilities within a school for little children, and then for example, the water point was a half-meter high that a child couldn't really reach to the water. So for me, it's just considering our target group, who are we serving, and then build the system around those people. Of course, if it's a maternal health facility, then we really need to consider the needs of women in those facilities. Of course, we're expecting to have maybe some people with disability. Then we also need to consider those the needs of those people into our designs from the very beginning. And it's like imagining ourselves going into those facilities, and then is that serving our needs or not? Does it make our life harder, or it's just meeting what our requirements? This is how I consider the human-centered design.
When I think of that in particular, when I think about disability access, and that's part of, at least for sanitation, part of the JMP requirements is disability accessible toilets. And you can tell when that's been on their mind, but maybe the engineers haven't consulted with people with disabilities, and you end up with a ramp that's so vertical, someone with a wheelchair could never make it up. So it's like, you started it, but you didn't quite get there. And so I think about not only taking human-centered design from perspective of what boxes to check, but also the stakeholder engagement piece. How do we work with those individuals to make sure what we think they need is actually what's required in these facilities? Mike or Jose?
Yeah, I would just say that, for me, there's a lot of different guidelines, and we can talk about ramp slopes and things like that, and get into the technical nitty-gritty. But at the end of the day, what I always challenge the engineers that are working on the healthcare facilities is think about it from the perspective of your grandmother. Your grandmother's probably sick. That's why she's come to the healthcare facility. She's not feeling very well. She's a little bit unsteady, right? And so how is she going to use the facilities that we have designed? So that gets to, making sure you've got some handholds at the bathrooms. Make sure that you have adequately sized doors so that she can get in, maybe if she's got a walker or on some other assistance. Or maybe she needs to have some assistance from another person to be able to get into the bathroom, right? So to make sure there's enough room for those kinds of activities. So for me, it just helps to put it in the context. I think about my grandmother. I love her very much, and I want to make sure that she's can move around when she's in this state of stress, to be at a healthcare facility and be able to use the services. One of the common things that I see is that just even distance from wherever the beds are or the clinic itself to where the water is. We may think that it's not that big of a deal. When we think about schools and homes, that distance can be relatively long. It could be maybe 50 or 100 meters. But that doesn't cut it in healthcare facilities. It needs to be very close, because people are not feeling very well, and they need to be able to access those services very, very readily. So that's just what I think kind of brings it into perspective for me.
Yeah, that's great.
Yeah. And I could say, Lindsay, from a human-centered design perspective, as you've called it, I think also the climate resilience perspective is very interesting here, because some cases, when you bring these teams together to try to retrofit a healthcare facility or even to do the planning, and then it's like, well, so, climate resilience, climate change, it looks like a little bit like, and what are we going to do, and what does this mean? So this is exactly the thing, as well. I mean, it's something that you can do, is that you have to do, is to talk with the community and to understand what are the climate patterns, what is the climate variability, what is going on with droughts, are they becoming more intense, what is going on when it rains, where is the water getting stagnant? Because, you don't want to come there as the field engineer, go to a facility in a sunny day and not understanding really what is going on when it's the rainy season, and what happens, what are the contamination routes, and where to really locate the facilities, because it may look okay in a map, and having some good cartography, but being there and sensing and discussing with the community what happens, what's going on, I think it's very important also from a climate resilient perspective.
You brought up some really important points here. And I think about also when we think about human-centered design, not only, certainly as Mike said, most people in healthcare facilities don't want to be in healthcare facilities. They're there because they're sick. And how do we care for them and make their life easier, not harder? But I also think about the behaviors that need to take place in a healthcare facility. We expect clinicians to wash their hands. We expect that cleaning will take place regularly. All of these behaviors that make sure that safe, dignified care is provided. The infrastructure can either hinder or encourage those behaviors. I think we talk a lot about nudges in WASH. So I think of the example of, I've seen healthcare facilities where the sink is so far away, when we talk about this, no clinician would use it. Or I think a study by Johns Hopkins in Ethiopia found 74 nurses to one sink. Again, not particularly conducive to hand washing. So how can we think about the infrastructure from a human-centered design perspective and how we're encouraging those to be used and what behaviors we want to see happen? And that again comes back to talking to the community, talking to the healthcare workers. What do they do? What does your day-to-day routine look like? And then designing around that whenever possible.
Yeah, I think, Lindsay, that's so important because the context of the patients and what their background is really important to be able to use the facilities that we design as well. I'll just share one example is I couldn't understand why the latrines that were designed at one healthcare facility were not being used. There was still open defecation going on. And then I realized that the people who were coming to the facility, most of them were practicing open defecation. They simply did not know how to use a toilet, right? And so when we folded in that training into the orientation for any patient that came to that facility so that they would then know how to use a toilet, then we finally got the system to be used. But as an engineer, we're like, what's going on? Why is no one using my beautifully designed latrine, right? And the reality is we didn't make that final connection to the people so that they knew how to use it. So don't just make assumptions that people have certain knowledge. And of course, with healthcare facilities, we've got a lot of turnover, right? We've got a lot of people that rotate through there. So you can't just do orientation once. It's one of the things that's kind of the fundamental blocking and tackling, as I like to say, where you just have to keep it up and make sure that people have the appropriate orientation to use the facilities that are available. Because don't just assume that they know how to do that.
Jose, do you have a thought on that?
Just a super short comment building on this, is the human-centered design, but also we need to understand, what is culturally appropriate,
Sure.
Sometimes, if we are working in an international environment where, today we're in Jordan, but tomorrow we are in Ethiopia or somewhere else, like Hiba has just moved recently, and I've been also to different stations, we need to understand what is going on, and it's not always the same. There are many different sorts of hygiene and sanitation practices. And this is something as well, that I think as engineers, we are a little bit lazy with this, because we go with our dimensioning and our models and what we have learned in school. And sometimes, in school, we haven't been really told about these things, like talking to the community, understanding what is culturally appropriate and not. So it's never too late, but I think it's not in our genes, but we have to, if we're now discussing among engineers, and this is supposed to be, discussion to feed, some thinking into fellow engineers is just this, is thinking about the different cultures, what it's going to be used, as Mike just said, and building again on what we said at the beginning is not a copy paste. I mean, here it's very important that it's not.
Well, and Jose, I'll actually have you continue on that, thinking about climate resilience in particular and copy paste. What are your, I guess, when you think about Washington healthcare facilities and climate resilience, you've talked about this a bit, but do you have any initial thoughts on how to improve this? We know many facilities are not climate resilient to date.
Yeah, and we have already discussed some of the things. I think Mike already at the very beginning made super important points. I have made some notes, here for myself, so that you will see me looking down, so I don't want to forget things, But we have discussed floods and droughts is not the only thing. There are other climate risks that need to be understood. understanding the particular risk where you are and in the location where you are is not the same healthcare facility in your country in the north or in the south. I'm just now in Spain where the climatology and the climate risk are completely different in one part of or the country or another. You know, as we said as well, you need to understand if you're, this is basic, you know, as an engineer or as an architect designing this, you need to understand you are facing drought, you are facing floods, or you are facing absolutely everything under the sun. And then, you know, in terms of you know, the combination of water supply and droughts, Mike was talking about the importance of water storage. I think, you know, I think this is the key. You know, a healthcare facility cannot operate any minute without running water. And if something happens, you know, and it's climate related or not climate related, you need to ensure that water is going to be running through the healthcare facility. So you need to have a storage of a minimum, you know, let's talk a little bit more engineering. Let's at least design a storage for minimum 2 days, you know, so that when you do your dimensioning, you have water storage for running into the facility for a minimum of 2 days. Let's also think about the different uses and potential expansions that you, Lindsay, were already mentioning. You know, how a storage room is suddenly converted into an operation room or something else. You know, let's think about expansion. Let's think about population growth. Let's think about incidents like the one we're facing right now. You know, pandemics, where suddenly, you know, you have a healthcare facility that is all overwhelmed. This needs to be factored in. You have to be a little bit creative and think about what is the backup solution, even if that storage fails. You know, where are you going to be bringing the water from? Even if it's going to be water tanking, you need to have a pre-arrangement or something. You know, but you need to make sure that the water will be running in case of an increasing incidence of droughts. Water quality testing is also key in a context of, you know, increasing incidence of droughts or floods where water quality is compromised. Then I think water management is something that it sounds a little bit too complicated, but it can be really, it can be something very tangible when it comes to the design of water supply in a healthcare facility together with droughts, let's say. You know, we're talking about making sure that the water supply is really efficient, that there are no leaks, you know, conservation of water, This is something that it can be perfectly implemented, you know. There are many different technologies, you know, for water supply and also for sanitation. You know, you can have these press taps where you just have some water running, but you don't run the risk that the water is going to be running for hours. You have also some sanitation options, you know, that dry urinals or some other technologies that will help you conserve and save water, and also reuse, you know. I mean, if possible, you know, some of the water that is running from the taps can be reduced. And at the end, I think it's always good if public institutions like healthcare facilities and schools lead by the example, you know, because this is something that is going to be used by all the community, and then you get back to your household or your community, and then you want to, you know, but again, you know, the public or private, you know, facilities should be leading by the example. In terms of sanitation, I think it's super important from an engineering perspective to have floods in mind. We have already discussed that. You know, we're talking about elevated sanitation infrastructure in case of potential flooding. We are talking about sealing, you know, infrastructure, and that it's meant for containment. You know, we're talking about septic tanks that need to be really well sealed. The cover needs to be sealed. It looks something obvious, right? But sometimes you need to understand that you are in an area where floods happen and where water gets stagnant, because if you are going to locate your septic tank there, you better make sure that it's sealed, and even, you know, there are non-return valves, you know, built into the pipe so that there is not backflows, for example, you know, so you don't want the contamination, especially in a healthcare facility where you may have hazardous waste as well, you know. You don't want that to be exposed to a flooding where, I mean, it can be a disaster, you know, even well beyond the facility. The contamination of water can be a real challenge. So I think these are some things. Yes, a little bit more helicopter view, or more you know, more thinking with climate resilience is that whenever you are either retrofitting or planning for a new infrastructure, I think you need to make sure that you are aligned with what is going on. And what is going on in your country in terms of climate resilience? Well, in many countries, there are national adaptation and mitigation planning processes where things are discussed in the sector. You know, the water and sanitation sector is part of multi-sectoral discussions where climate change trends are discussed, impacts are discussed, etc., and where priorities are also set as part of these national adaptation and mitigation planning processes. Indeed, in most of the countries where participants of this course are listening to or participating and taking this course, you know, there are national commitments made to the Paris Agreement, you know, and those are aligned with adaptation and mitigation priorities. So, you know, they may not talk exactly about what's in healthcare facilities, but understanding a little bit what is going on, you know, and what are the trends in your country in terms of adaptation and mitigation, the use of solar energy, renewable energy as well, you know, as it comes to, it's not going to be just in a school, just about water and sanitation, it's going to go also into electricity and some other things. But there is an opportunity also for the waste sector to contribute towards a low carbon development in the countries where we operate.
And I'd like to build up on what Jose said. I've got 3 points I'd like to do, and then I'm very interested in what Hiba has to maybe add into the conversation. First of all, I'm a strong advocate as we manage the risk of wash care facilities, wash and healthcare, is over drilling wells at healthcare facilities. So to drill that well an extra 10 meters isn't all that expensive at the time when you actually drill that well. And it gives you the ability to lower the pump in the future if you have a drop in those groundwater levels. So instead of maybe going for a little bit more of an over drill compared to what you would do at a school or a public system, just recognize the risk at that healthcare facility. So that's one. The second is look at the overall water usage of the healthcare facility itself. I remember going to one facility, a major hospital in Ethiopia, and they were complaining that they didn't have any water. And the whole time they were explaining that to me, they were using water to water the gardens and the flowers, right? So look at maybe the garden design, the landscape design around the facility, and see if it's appropriate for water conservation. I think that's an important part. And there's opportunities at the larger facilities also to use gray water to do those activities, to water the gardens and the flowers. I want the grounds to be very pleasant too, but the primary goal is to get water to the patients and the doctors. So I think we need to keep that in mind. And then the last thing I'd like to point out, the third, is that, you know, Jose's talked many times about not having a cookie cutter design. And one of the things I've seen in India specifically is that the idea of having one solution that they can always use to do water treatment. And because of that, they go to reverse osmosis. And I think all of us know that reverse osmosis has a lot of reject water, a lot of backwash water that gets wasted. And in climate challenged areas, this can be a major problem. So the idea of using the right treatment solution for the context is really important. So don't necessarily just jump to reverse osmosis when maybe simple chlorination or an ion exchange water treatment is appropriate. But Hiba, you have anything you'd like to add?
Well, it's very hard to add after you two, but no, it's exactly the case. So I mean, in terms of having the guidelines, those exist. Like well, we know how to design a water system. We know how to design a RAM for like it's those are existing information. The thing that we really miss on is the taking into our mind the environmental considerations when designing our sanitation systems, when looking at the source of our water. As you said, the RO in a drought-prone area is not really a smart solution. Maybe also adding to your story of using the main water source for gardening is not quite ideal. While maybe you like as an engineer, we could have thought of separating the resources for really really the surgical needs and the health and medical needs from the other water needs and gardening and other services. So it's really looking at the small things. It's really making sure that we have enough coordination, we have enough consultations with the community, with the health practitioners, and yeah, that in a nutshell, this is what I have to add to the interesting contributions you've made.
Well, and I have one final question for you, because climate change is, of course, super important right now. It's something we're talking about as we improve the healthcare facilities, building them new or retrofitting. But coupled with that is the other clear emergency right now, COVID. So as you think about COVID from a design perspective, as you think about it, if you're coming in from an emergency perspective, Mike, what does COVID mean for engineers?
Yeah, I guess one thing that I get a little bit frustrated right now is that I think some organizations are not approaching COVID as a disaster response. And I believe truly that that's the mindset that we need to have. And so what does that mean? That means that one, a rapid assessment is very important. An assessment that's going to get completed 2 years from now does us no good. So be creative. I know WHO, in partnership with Engineers Without Borders and Food for the Hungry, developed a rapid COVID WASH assessment for healthcare facilities that allows it to be done by healthcare operators themselves and not have to bring in a team of experts, because we know travel is limited right now during the time of COVID. We can't let the perfect get in the way of the good during this response. The second thing is we need to be very cognizant of the stresses that COVID provides onto healthcare facilities. And this is primarily in water demand, because not only do we have more patients, but each patient requires more water per patient than they did previously because of the COVID treatment process. So that means more water supply, that means larger storage, as Jose has mentioned many times. We need to be very, very aggressive in making sure that we come to that prepared. And as I've worked with many hospitals and talked about beefing up those facilities, it's, hey, I'm going to be adding more storage. I'm going to be putting in a bigger pump. And I hope we never have to use it, because I hope the wave never really comes, but we need to be prepared. I think that's a mindset that we need. And then the last thing that's been very disturbing to me, we just completed a rapid assessment of waste management at UNDP across all of the 5 UN regions. And I'm seeing that the economic budgets for WASH and healthcare facilities are being stressed. And I'm really concerned that we're going to see actually an erosion in the JMPs in the near future as we see budgets become reduced for WASH and healthcare facilities. And it's not surprising, right? If you're a healthcare administrator, you need more resources to deal with the COVID-19. You're probably prioritizing that again for staff, pharmaceuticals, oxygen, medical devices, and it's easy to kind of defer WASH activities. You know, we're seeing things like the medical waste not being disposed of anymore because those budgets have been cut and the providers haven't been paid in 5 months. And so now we're reverting back to doing open burning in pits, where before we had a proper collection and disposal. I'm worried about that. The other areas is water that's being provided to the healthcare facilities from municipal sources. Many countries, well-intentioned, have said that they're not going to charge for water in their countries during COVID-19. But now, as we've gone several months in this situation, they no longer have the revenue to operate the systems. They don't have the revenue to pay for the electricity. They don't have the revenue to do the maintenance. And so we're starting to see an erosion in service to all water supplies. In particular, it's concerning, of course, to healthcare facilities. It's a good example of good intentions that maybe have unintended consequences.
Jose or Hiba, do you have thoughts on your own work with COVID-19?
Maybe I can comment. So like the very interesting about COVID is that nobody knew how long it would last, and then there have been a lot of competing decisions at governmental level and onto like, because we also added isolation centers, and we're treating them as if they're medical facilities. And then we initially, as the COVID has started, lots of governments decided on to turning schools and universities into isolation centers, for which now, after like being into a couple of months into this, and there's no any foreseen end of the crisis, the governments are considering again reopening those schools and those universities into education. So like from my experience, I've seen that there have been troubling decisions in terms of how do we where do we put the patients, how do we handle the isolation centers. Having a lot of patients all at once means, of course, preparing for enough water sources, for the sanitation, for solid waste that generates out of that. But then like crashing all those facilities again into, so we need to be really clear. Is it a sustainable healthcare facility that we really need to invest on, or is it a temporary kind of emergency that we're supporting for a shorter period of time? So these are things we need to make ourselves aware ahead of time before we really invest a lot of money into those facilities.
Absolutely.
I think that's what Hiba has just said is so important. And I think this is interesting because Hiba and I, we have worked together, and we have worked together in Jordan, and trying, we didn't succeed at that time, trying to support WASH in healthcare facilities. But let me tell you something, because when I'm thinking about COVID, somehow many times I think about, and I think about us as engineers, we love information, we love data, we need data to, you know, our calculations and to run our formulas and to put our brain into excitement, if you like. And it is very difficult for us to operate, you know, trying to take WASH in healthcare facilities forward if we don't have the baseline information. This is something that Hiba and myself, we made a team, you know, and we were in high-level discussions with WHO in Jordan, and at the end, you know, we didn't succeed at that time. That was pre-COVID, you know, in trying to establish a baseline. A middle-income country such as Jordan, you know, with access to water and sanitation pretty high, you know, but still a little bit unknown of what is going on in public and private healthcare facilities, with some recent information about WASH in schools, which is letting you to think that something may be going wrong and WASH in schools. And also when discussing, as we have talked, you know, with communities and with trying to understand the culture, just sensing that something is perhaps not going well, you know, the importance of having these baselines, because some countries have run into this global pandemic now, trying to foster in some cases WASH in healthcare facilities, but not having the right information to build on something we just, Hiba just said, which is sustainable interventions. What is what we are going to do? Because then suddenly engineers, we are faced with and confronted with having to take design and supposedly informed decisions when we don't really have the right information. So I think for me, I'm just thinking about, you know, how important it is. And if countries haven't done that yet, I mean, doing your baselines, understanding what is the situation, running the WASH feed and other tools to try to understand what is the situation of water and sanitation and hygiene, because in your facilities, because for me, this is the other thing, you know, also as engineers, you know, with hygiene, we are a little bit, we like to, you know, design our pipes and our sanitation systems and all that, but hygiene is a little bit of something that, you know, it's a little bit less important. I mean, hygiene stations, we have seen it now, we see it now every day, you know, it's super important. And having that in mind, and where are they placed, and how are they fit, and it's going to be water. And if you're in a drought-prone area, whether there are other things that you can do, but also, you know, so it's for me, it's these two things, you know, with the COVID, in my experience, you know, it's baselines and having the right information, and also like for us engineers, also not to forget about the age of WASH, the hygiene.
Well, and that touches on, I think, all of you kind of summarily, it is an emergency. We have emergency response, but how do we build into that a more sustainable solution, particularly for a pandemic that could last another year and a half? But on top of that, for the fact that we don't know when the next one will hit, and how are we preparing these facilities to be resilient in the face of climate change or in the face of an emergency like a pandemic. So I really appreciate all your thoughts here. I want to give you all a chance to give one final word, a piece of advice to your fellow engineers working in healthcare facilities. What would you tell them, and making sure that we're going to have sustainable WASH for all healthcare facilities in the future? Mike, do you want to go first?
Sure. So I'll talk about maybe 3 areas of advice that I would give. One is, don't forget the risk assessment, right? These are high risk environments with pathogens. If we don't have water, we need to make sure that we have a higher factor of safety, if you will, for these types of facilities. The second is kind of building upon that with wastewater. Don't forget the wastewater. Make sure that if you're providing additional water, you've got treatment for that wastewater. If you don't have the resources to treat the wastewater, you're probably better off going to the standard latrine. I love latrines. So I know everybody wants to have that piped water into their healthcare facility, but if you can't treat the water that comes out of that washroom, stick with the latrines. And finally, the last thing I'd leave you with is, as you design the facilities, think of your grandmother.
I love it. Hiba, what are your thoughts for your fellow engineers?
Yeah, it is like we're engineers, and we're really usually focused on the technical nitty-gritty of everything, but it really worth to consult and reach out to the community, to the practitioners, just to make sure we're reflecting on their needs, and it's not just our own perspective of the story.
Thank you. And Jose, your final thoughts?
I will also put all my eggs into one single plea, which is, work towards the standards. As we've been putting, and I've been just doing a little part, helping you to put this course together and trying to see, national or subnational standards that can be taken as an example. We haven't been able to find any climate resilience reference into anything that can be even, shared as a good example. So my plea is, as you go through this course and you think about these steps where you are prompted to work with WASH in healthcare facilities standards, either they are standalone, as Lindsay say, or part of broader standards, but please, try to build good ones now, where climate change and climate risk, as Mike said, are already incorporated there, because otherwise it's going to be too late later. And you don't want to be, as engineers, we don't want to be having these discussions at the facility level with people that in many cases won't be able to understand our thinking. We want, if possible, to have things reflected in standards, because it's going to make our lives so much easier.
Well, thank you all for all of this. I'm really excited to share with the participants about this. Mike, do you have one more thought?
I do. And I kind of put this out as a challenge to all the engineers that are watching this, because I think as horrible as COVID is, it also gives us an opportunity. Mm-hmm. And the opportunity that it presents us is there's a few very systemic problems that we've had in healthcare facilities that we've been fighting for years. One is water, the other is oxygen in healthcare facilities. And we also realize that the economic impacts of COVID are going to be longstanding. I know that many of the prediction models are saying it could set back our progress in the SDGs by 10 years or more, and primarily because of the economic impact. So that means that every country, every location that you're working in is going to need to have an economic stimulus package. And I'm a transportation person in background, but we don't need to repave the road in front of the mayor's house again, which is usually what ends up happening as far as a stimulus package. So let's use that investment to correct some of these systemic problems. Let's get some oxygen into these healthcare facilities, and more importantly, let's fix the WASH. So let's be thinking about that, because we need to make sure that those assessments are completed now, so that we have investment-worthy stimulus work that can be done as we need to stimulate the economy after COVID. So that should be a challenge for all of us as engineers, to start to work on those things now, so that we're prepared when those opportunities come.
I think that's a great place to end it, Mike. I think there, like you said, there are opportunities in the years ahead of us to advocate for WASH in healthcare facilities, and certainly to build back better. So thank you all. I'll leave you here, and hopefully you all gain some insight from this. We'll be making a reference list for resources and key takeaways from this session, and we will see you next week. Thank you all.